Are you searching for a deeper understanding of yourself and your place in the world? Do you yearn for more balance, more peace, and purpose in your life? Well, look no further than the Intuitive Revolution podcast, your trusted source for holistic insights and intuitive guidance. I'm your host, Alicia Farricielli, and I am ready to take you on a journey to inner peace and balanced well-being. Welcome back to the Intuitive Revolution podcast. I'm super excited. We're going to talk to Karese Laguerre today. She is a myofunctional therapist, which has some really cool things, some things that she's going to talk to us about, ways that we can implement some of these techniques into our daily health. So welcome to the show, Karese.
Thank you so much for having me. I'm happy to be here.
Awesome. Well, tell our listeners your journey, how you got from being a dental hygienist into a new practice and what you're doing right now.
Yes. So it all really stemmed from my children. And I think as parents, a lot of people can probably relate. Our children change us in many ways. For me, it just happened to be my career trajectory. Now, as a registered dental hygienist, I was working for a pediatric dentist that really highlighted how some of the issues I was having with my children really just stemmed back to the way that we were breathing, the way they were using their oral facial muscles. And as a mom of four, I think we were going through things that were so very common, but I had no idea that it wasn't normal because everybody's experiencing it. So my son, he's my only boy. He's my oldest. And then he's been disappointed every time I've gotten pregnant since. He's my oldest. We had a lot of issues with him and attention, behavior, social, emotional regulation, and just typical ADHD signs. We did wind up getting an official diagnosis around the time he hit 5th grade. And then we medicated for 1.5 years. And that was disastrous. But we'll get back to that in just a second. My oldest daughter had every sleep issue under the sun. You name it, we dealt with it. Every night we were guaranteed some type of sleep problem. So whether it was bedwetting, night terrors, sleepwalking, falling out of bed, tossing and turning, like a restless sleep, we had everything, like the full gamut of sleep issues. The pediatrician always kind of dismissed it. And, I'll never forget, she was like, she won't be 15 and still doing that. Like, she'll grow out of it. It's like, okay, but how long do I have to tolerate this? Yeah. So then my youngest two girls had a lot of issues with breastfeeding and then upper respiratory issues. So it was chronic ear infection, throat infection, ear infection, throat infection, that cycle of constantly going back to the pediatrician and you're getting antibiotics. And it's the same thing every time. It's either their ears, their throat, or if we were lucky and we hit the jackpot, it was both at the same time, right? So we were going through a lot of those things. And those are the things that I think when people are asking you as a parent, how's everything? We always give the highlight reels, right? Like this one's in dance class. We got a recital on such and such a day. We're playing soccer. But we don't really talk about a lot of the things that are actually going on. And had I talked more about it, I think I would have gotten help sooner. But it was a pediatric dentist that really put everything together for me and was able to kind of underline how all of their things that manifested in them, be it sleep or upper respiratory issues or the faux symptoms of ADHD, really all stepped back to the way they were breathing. And once I discovered that, I dove in deep and I started to see changes in my family that were just amazing. I felt like I met my children for the very first time. And I had to help as many other people as possible after that.
Yeah, I can imagine a mom, and it's like you're probably thinking, "Oh, health issue, something's like all the time going on top of their extracurricular activities that you're having to do." Just being a normal quote unquote parent, in your job and stuff. I can imagine how overwhelming that was for you. So, how did you get introduced into doing what you're doing now? Was that from that pediatric dentist?
Absolutely. So it was pretty much direct. She was like, look, this is something that you can do and something that you should do. You should seek out more information. And I started to dive in, and it was something that I was like, okay, I need to take the coursework. I need to get certified. Like, I have to do all these things to help my children because, if I wasn't going to help them, who was?
Yeah. So tell us, what is myofunctional therapy? Yeah. Tell us exactly what that is and how it helps. To a bigger extent. Yeah.
Absolutely. Yeah, I get that question all the time.
I
It's
bet.
not talked about enough. Myofunctional therapy is kind of like having a personal trainer, but for all the muscles below your eyes, but above your shoulders. So I work with all the wonderful muscles here because there's a wonderful over 100, honestly, sets of muscles that really do work together to help us properly breathe, chew, swallow, digest. And it really does help in order to really transform sleep, transform the way we are digesting some of our cognitive abilities. It is phenomenal, myofunctional therapy, but it's like a holistic way to really address dysfunction going on in that region.
Okay, so kind of like a physical therapy maybe that you would do for your your face, lower region of your yeah.
Almost. I wouldn't really liken it to physical therapy. I would liken it
Yeah.
more so to personal training just because there's
Okay.
that level of accountability there with like personal training, right? You imagine you go
Yeah.
to a gym, you want to work out with a personal trainer, get six pack abs, and you go to the gym maybe once or twice, but you don't go back again. I mean, you won't really get the six pack abs. So it's really like a commitment
Okay.
based thing. Yeah.
Yeah. So outside of the issues that you dealt with your children, what's some other benefits, say, for a 35, 40, 50-year-old female male?
Yeah. Asking for a friend, right?
Yeah, asking for a friend. I'm going to say I'm 35.
A biofunctional therapist would be really good for those who are older who might be experiencing unrestorative sleep, if they have obstructive sleep apnea that's been officially diagnosed, if they have a TMJ or other oral facial pain issues. Those are the ones who really do benefit from myofunctional therapy the most, because it's going to help restore the oral function that will get them back to having a pain free or tension free lifestyle, being able to really prolong the amount of health they can have in that joint for their jaw and to really establish better sleep patterns.
That's so cool that you can take something like that because we don't think about that. We're like, okay, we have TMJ, we go to your dentist, we get all these things in our mouth, or we just get on painkillers, or it's like I don't have that. I'm very lucky, don't have that issue, but I know people that do. So it's just like it seems like a cycle of nothing that's really it works, but it's almost like Band-Aid over fixes. So it sounds like this is really something that is a good fix for the long run.
Exactly. It's getting to the root cause. Whereas
Yeah.
a lot of the things that are out there, be it Botox, be it those appliances like you mentioned,
Yeah.
even massage or manual therapy, a lot of that is just like a holdover palliative type of, okay, we'll put a band aid on the issue, but it doesn't really address what the root cause was.
Yeah, that makes sense. If you're working your muscles, like you said, you're a trainer working out, working your muscles, it's going to build that muscle and it's like building something stability for, the rest of your life. So, yeah, I love
Exactly.
that. So, let's talk a little bit about the impact of breathing on sleep quality because I know a lot of people, even myself, especially our listeners out there, are having sleep issues. It's I would say
Yes.
probably 9 out of 10 people are having some type of sleep issues. What are some benefits for that?
Yeah, you are spot on with the fact that a lot of people are having sleep issues. The CDC in 2015 said that it was a national epidemic in America, and the WHO, the World Health Organization, said in 2019 that it was a global epidemic. So we are 100% in sleep crisis. So sleep really does relate a lot to breathing. And I think a lot of people Google what's going on with my sleep or sleep hygiene tips, and you're going to get everything under the sun from like different pillow recommendations to like not using your phone at night. But you could do all of those things. You could Google and you could do the first five things that you see, and I guarantee you it's not really going to do much for your sleep if you can't breathe well. Because our body's
Yeah.
main objective is to keep us alive. So when we're asleep, a lot of things shut down, but never a respiration, and certainly not our brain. Our brain activity actually ramps up
Right.
and is working more. But our respiration is really what's helping to cycle and to fuel a lot of what's going on for the restorative process. So sleep is for restoration of the body. We get cell regeneration, memory input. Our brain is detoxing during that time. Like a lot of wonderful positive things are happening while we were sleeping. But the body has to prioritize what can happen if you are suffering from, obstructive sleep apnea, or you are snoring, and we'll get to snoring in just a second. You're snoring or you're not really respirating properly while you are asleep. Now your body's going to prioritize breathing and keeping you fully oxygenated. So it won't do some of those restorative processes. And you might find that you're finding yourself waking up more frequently, or you're waking up in the morning unrefreshed, even though you may have been in the bed for 8 hours. You may have only gotten maybe 2 hours of quality sleep, because your body has to now reprioritize so that respiration can be the main focus instead of getting all of those wonderful restorative processes done. So just to touch back on sleep really quickly, on the snoring, I'm sorry, really quickly. The snoring, I think a lot of people just kind of dismiss, or sometimes you think it's cute or it's normal, or you may have like generational snoring, whatever that's supposed to mean. What snoring really is, when you lie down, the very first stages of sleep involve muscle relaxation, and it just gets into deeper muscle relaxation until we're into muscle paralysis. But we get muscle relaxation, and then when we lie down, we also have an increased force of gravity that's on top of us, right? So if we think about our airway, a lot of our upper respiratory tract it's soft tissue. And so that soft tissue muscle starts to relax, and then gravity puts a force, and maybe our tongue falls back. So now we have a really narrow space. And that's the sound of air now that you're hearing trying to force its way through airway. So when we think about breathing, if I was to hear that there's an audible way for me to know that air is struggling to get to my lungs, I would want to do something about that, right?
Yeah.
It's like if I knew that, I would chew a cheeseburger and then it would take a struggle to get to my stomach, well, I would address that right away.
Right.
So snoring, I think we need to think about in that same manner, where that's air that is, meeting resistance, struggling to get into your lungs. And that's really a primary sign that you're not going to get a good night of sleep, because you're already struggling with respiration. And that is our key primary function. We can go for weeks without food, days without water, but not many of us can go for a few minutes without oxygen.
Yeah. I mean, the breath is our life. Prana
Yeah.
is like life, it's breath, for that. So
Yeah.
yeah, that's very interesting you brought that up, because a lot of people think, oh, I'm just snore, but it shouldn't be a health issue. But snoring creates so many health issues within us. First of all, if our brain is not getting the oxygen, like you said, on that, but heart issues, all kinds of things happen with us not getting enough adequate breathing going on in our sleep. So it's really cool. So talk to me about ADHD and how myofunctional therapy works with that.
Yes. Okay. So I touched on really briefly my son's story. I'll give that story just a little bit more fleshed out, and then we will get into the myo part of it.
Yeah.
But my son, I remember when we went with him to the first kindergarten teachers meeting, and the teacher says, during circle time, he's just not attentive. He will take his eyes, he might focus it on a little ray of sun. So, there's the dust that you can see floating around
Yeah.
in the little rays of sunlight that come through a window. He would take his eyes and he would focus on one of those little dust bunnies kind of floating around, and his eyes would just follow all the way down, and then maybe he might pick another one. And that was the most attention he would give anything. Out of that, he would not be focused. He could not be redirected. Like all day long, she's trying to manage this child. And so I hear that as a mom, and I'm like, but he's 5. Like, he doesn't want to be here, lady. It's okay.
Yeah.
Like, relax. We had a meeting with the first grade teacher. First grade teacher had a very similar thing. It was very hard to get him to be attentive, and she has to refocus him, redirect. And I'm like, but he's 6, we played that game with every teacher up until 5th grade, where it was like, but he's 7, but he's 8, but he's 9, and then at some point we really had to stop and reassess the situation and say, okay, something's going on here. And by 5th grade, it's starting to look like he wasn't going to make it through to 6th grade, that he might have to repeat. So we got an appointment with a pediatric neurologist that was the best in the state. We were living in New Jersey at the time, top pediatric neurologist in the state. We waited 6 months to get in to see her. We get in to see her, and it's maybe 10, 15 minutes max that she spent with us. She had a little checklist. She asked us some of the questions off the checklist, and boom, that was it. Like, she didn't do anything wrong. We all have to remember that ADHD is a symptom-based diagnosis. So she asked us from a list of symptoms, and boom, that was it. So we got the diagnosis and we got medication. And we cycled through for a year and a half. We cycled through 3 different medications, and none of them really helped or really worked. It was supposed to be the short acting. He takes it in the morning before school. It lasts all the way through till after school, but it really wasn't helping him very much
Yeah.
with his focus or attentiveness, which is why we kept switching. So at one of our next appointments, after this year and a half period of time of us trying different medications, we had another meeting, and I had already had the conversation with my pediatric dentist about what was going on with my son and his sleep, and not his sleep, I'm sorry, with my son and his inattentiveness. And she told me to start watching his sleep, that the sleep might be what's really going on. The more I dived into what it was that she was talking about, and I realized that there is this overlapping connection. So there's 70% of an overlap between the
Wow.
symptoms and manifestations of ADHD and that of sleep deprivation in children. So sleep deprived children have 70% of the same symptoms as those with ADHD. And I think that's incredibly important
Yeah.
because with ADHD, like I mentioned earlier, it's symptom based diagnosis. There's no blood test, there's no, workup you can do with an MRI or a CAT scan. You can't definitively say,
Yeah.
there it is, I see the gene for ADHD, it's there. With a sleep issue, you can do a sleep study and you can rule that out. It's like a differential diagnosis. And there's so many ways to naturally deal with sleep that it would have been nice had I had that as a differential diagnosis for my son at the time. But to come back to his story just really briefly, we went back to the pediatric neurologist for our next follow up, and she's getting ready to give us a 4th prescription for a new medication. And I said, no, I really don't want it. I would like to go and get a sleep study, and I'm going to go check his sleep. And she said, whoa, whoa, whoa. Right away. You never told me anything about his sleep. You didn't tell me that he had issues with his sleep, because I would have told you that, that's definitely something that we could have looked at before and whatever. And I was very upset because, one, I was never asked about his sleep. I was never told by her or anyone in her staff or her team to look at his sleep. And it just confirmed for me that I was going down the right track, because even she, as like this top specialist in our state, knew that there was this connection. And so it turned out for him that it was actually a sleep disorder and it wasn't actually ADHD. And once we dealt with the sleep, he actually wound up to be like this brilliant child who was totally, hampered by his lack of sleep. So he went from the 5th grader who couldn't focus and was not going to make it to, at 17, he graduated high school a year before his peers. He was like
Wow.
this brilliant child. And so I forever feel that guilt, but it is something that I'm so glad to be here and to talk about more. It's important for a lot of other parents who can catch on earlier, that they understand that this is a real connection. And so if you're worried about your child and ADHD, check their sleep.
I love that you brought that out, because we're so quick to just diagnose any type of attention thing going on as ADHD and pop a pill for it and be like, on. That's what, doctors, people have been trained to do. And
Yes.
so as parents, I mean, we don't know these things. We come in, this baby is born, and especially if you have no medical knowledge, you're like, what do I do? So you go to a specialist, and the specialist does what they're been trained to do, but not always asking the right questions to, to diagnose that correctly. And so I think I love that we have people like you coming out and educating, the mass audience of there are other alternatives, especially if you don't want to put your children on medication. Go dig deeper, and this is how you dig deeper and where you go look. So
Yes.
yeah, parents probably, a lot of them don't tie in sleep with any type of behavioral issues, or if your child's sleep grumpy, you're like, well, you didn't sleep well. But other than that, they probably, I would have never tied that in, and
It's
my children were young at all.
Yeah, and nighttime for most parents, that's like our time. So those kids are
Yeah,
asleep. I don't want to watch them sleep. I want to
right,
now have mommy time.
right, right. They're sleeping. They're good. Don't wake up until until you
Exactly.
hear the coffee going. Yeah, awesome. So talk about the connection between oral health and overall wellness.
Yes. So oral health is really the start. Like health for a lot of things, it's really top down. A lot of what we ingest, whether it's food and the quality of the food that we're intaking, whether it's the air that we're breathing, and a lot of that is really either it's coming through your mouth or it's coming through your nose. Ideally, you want it to come through your
Mhm.
nose. But a lot of health is really starting top down. And so systemic health, it's incredibly important that we're mindful of what's going on as far as our oral cavity is concerned. So, with our mouths, we want our mouths to be nice, big, broad arches. So, when we have narrow, small arches, or so your teeth might be crowded, or it's just a really small mouth, or you might feel like your tongue's too big for your mouth. It's never the tongue's too big, the mouth is too small. So, when our mouths are smaller, that's going to actually leave us with a smaller space for nasal volume, for air, for
Yeah.
breathing, and a smaller airway overall. And like we've mentioned earlier, that air is critical for everything. Like breathing is top priority. But not only in our mouth is where digestion's occurring and where we are able to really facilitate the space for breathing, but our tongues and the connection that they should have at rest. So when our tongue is at rest, we're not eating, we're drinking, or speaking, we're not doing any of that. Our tongue's just sitting in our mouths. It should be up against the roof of the mouth, our palate. So it should be lightly suctioned up against the roof of the mouth entirely, all the way through to the soft palate, which is like the back there where we'll see our uvula, that dangly ball in the back of the throat.
Yeah.
It should be all the way back there because when the tongue is lightly suctioned up back there, we're able to stimulate our vagus nerve. The
Mhm.
vagus nerve is the regulatory system of our autonomic nervous system. So that's that rest and digest, fight or flight system. And when we can't adequately regulate the two, that's going to lead the body into all sorts of chaos and duress that will prevent you from not having adequate digestion, that might prevent you from having adequate flow of the blood, and you won't have the same cardiac responses. It's going to actually impact your overall health more significantly than a lot of other things will. So it's really important that we are on top of what's going on in our mouth, the size, the shape of it, and then like where we are at rest, because where what's happening here is really the most important thing for our systemic health and wellness.
Yeah, you hear, like, make sure you brush your teeth for your oral health, for physical health, but you don't think about your mouth. So, for let's say for listeners that have issues with, calming their vagus nerve, or they're in the fight, flight, freeze, and there's really not a reason for it. Could possibly be something they need to look into?
Yes, absolutely. Absolutely. When we're not able to adequately regulate, a lot of times that has a lot to do with our breathing patterns, whether we're over breathing, like hyperventilating, and you might not even know it's not like a true hyperventilation where you might imagine somebody like really like wheezing air, but you could be hyperventilating. And so you have a lower capacity for CO2 in your body, and that number really matters as much as any other number matters. That CO2 and the amount of volume you have in your body really matters a lot. But it's really important for our overall cognitive and mental,
Yeah.
absolutely, health.
Yeah, when your vagus nerve's out, it's very hard to function
Yes,
properly. Physically, mentally, spiritually, everywhere. So, it's like a
exactly.
huge, huge thing. So, what's some tips that you would give listeners who they're having issues with their vagus nerve?
Ooh, if you're having issues with your vagus nerve, I think it's really important that you start to slow yourself down.
Okay.
So, when you're in that high sympathetic tone, you tend to be more anxious, you tend to be a bit more ramped up because you're in that fight or flight. Like your body is ready
Yeah.
to take on a battle. But we can't socially engage in that manner. We cannot adequately like have good cognitive responses. Like we are wound up. So, it's really important that you take a second to step back. I would really encourage those who feel like you have issues with your vagus nerve to start engaging in some level of conscious breathing. I feel the easiest way to get into conscious breathing is not to like try to sit down and quiet your mind, because a lot of people find meditation to be very, very disruptive for them. They can't sit down and quiet their mind, but you can consciously breathe through a method I love, that's rhythmic breathing. Now, rhythmic breathing, I want you to take a song that's between 60 to 80 beats per minute, That way you can kind of bring down your heart rate, like you're going to level it with the song. But 60 to 80 beats per minute, a lot of songs like Bruno Mars or Maxwell, or there's a lot of different artists that have songs in that range. But the song, breathe to the song. Allow yourself to, allow the breath to dance to the rhythm. Just be very conscious. That's going to bring you back in under 5 minutes. Whatever song you're listening to, hopefully, is under 5 minutes. But that's going to bring you back to a source of center. And once you're there, just take active note and awareness of what's going on as far as your tongue posture. Like, is your tongue up there? So I think a lot of people after listening to this might go turn on a song. But where's your tongue? Do you feel your tongue at rest while you're breathing through your nose? Against the roof of your mouth. And if it's against the roof of your mouth, where's the back of your tongue? Can you feel that soft palate? If you feel those two engage, just make sure you can get back into that position next time you're feeling really anxious or wound up. That way you can connect your body a little bit more and ground yourself.
I love that technique. I actually do breath work with clients, but I've never really thought about doing the breathing to the song, because their mind's like going crazy, and they're just like, no, that's an easy way to relax and to start getting introductions into doing some more breath work. Yeah, thanks for sharing that.
No problem.
So for our listeners that want to learn more about you, contact you, hire you, how would they find you?
I am on all of the platforms, Facebook, Instagram, TikTok. I'm probably still on Twitter, or X is what it's called now, although I'm not super active there, but I'm on all of the platforms. I'm at the Myospot, TheMyospot.
Perfect. Yes. And all her information will be in the show notes, so definitely reach out to her. So I'd like to end it with this. What is the one tip you would give people to start today?
One thing is always to advocate for yourself. I wish I did that more. I know I talked about my children and all the issues that they had, and I didn't advocate for them in the way that I maybe should have. And I think it's important to know that if you are working with a pediatrician or a physician and you love them, you can continue to love them. But sometimes if something that they give you as advice just doesn't feel quite right, or you want a little more, advocate for yourself. Ask for a referral or go seek another specialist who would be willing to listen to you, who will give you alternatives, who would give you broader perspectives, because I waited too long for me and mine, but you don't have to wait for yours. If something feels unright, please advocate for yourself.
Yeah. You didn't wait too long. You just at the right, you had some learning to go. So thank you. Yeah. Thank you so much for sharing all this information. This has been fantastic. And I know our listeners are going to love this. Go take care of your oral health, your breathing health, everything, and then contact Karese, because you're going to want to get back in shape. So, thank you
so much for having me.